Hi, this is Dr. Bob with Carolina Value Pet Care. Thank you for joining us today. And today, although we talk about a lot of important topics, this is a particularly very important topic, and we're going to help you better understand heartworms. And why do I say that? Because this is a potentially life-threatening disease for dogs and for cats. So with that, I have my lovely assistant Shelly is going to be directing the conversation today with questions, and so let's get started.
All right, Dr. Bob, what is heartworm disease and how can it affect my dog?
Yeah, heartworm disease is a disease that dogs and cats can only get from mosquitoes. There's no other way they can get it. It is a mosquito-transmitted disease. It is potentially a life-threatening disease. So again, crucially important that we protect your dog. So the good news is we have a variety of different of ways of being able to protect your dog against this potentially deadly disease.
So how would my dog catch heartworm?
Only from mosquitoes. There's no other way, only from mosquitoes. But here's the consideration. Your dog never has to see another dog in order to get the disease. So the way it works is a mosquito would bite an infected dog and then goes through a little series of transmissions or mutations in the mosquito, and then that infected mosquito would bite an unprotected dog, a dog that's not on prevention. So that's the way it's going to be spread. Now, I will reference there was a study done back about 5 or 7 years ago, and maybe 10 years ago, in somewhere in Arkansas, and they discovered in Arkansas that, at least in this area, and I'm sure it's no different here in North Carolina, in the Piedmont area as it is out in Arkansas, but the average dog outdoors at night was getting about 3,000 mosquito bites per night. 3,000 per night. So what are the odds of a dog getting transmission of heartworm disease? And again, I know most dogs, for the people who are listening to this, dogs are inside the house, but again, think about it. How long does it take for you to go outside and get a mosquito bite during the peak of mosquito season? And again, some people are going to be more resistant or more of a magnet for fleas. But the other consideration, a lot of people think, well, my dog's got this really long hair. How is it going to get a bite? Well, we know the mosquitoes primarily target the face of dogs. Now, they don't react the way that we do, where we get the little, itchy places. Interestingly enough, that dogs don't react that way. But we know that the face is the primary target for mosquitoes, even with hairy dogs. Okay.
Can heartworm in dogs be prevented?
That's the beauty of it. Yes, we've had preventions available for years and years and years now, and we keep getting better preventions nowadays, because one of the concerns that we're starting to see in veterinary medicine, because some of these medications have been around for, literally 30, 40 years. So we are unfortunately starting to see some resistance with some of the heartworm preventions, primarily through what we call the ivermectin base. You've probably heard of HeartGuard or Iverheart, or two in particular that are ivermectin based, and we are starting to see issues with heartworm resistance in those situations. And we've been seeing this for about 10 years now, so this is nothing new. It is becoming more of an issue though. But the beauty is, yes, we have lots of different ways of being able to prevent heartworm disease very easily nowadays.
What are the signs in my dog that would indicate they may have heartworm?
Usually the first thing we're going to see, and understand there's so many variables if your dog is even going to start to develop any signs or symptoms of the disease. It depends on how many heartworms they have and actually how long they've had them. And those, we can do tests. And again, obviously we routinely test dogs for heartworms, but the test is just telling you, yes, your dog has the disease, or no, it doesn't. It doesn't tell us anything about how long your dog's had the disease or how many heartworms are actually living in the heart. But it's not uncommon for dogs to have 30, 40, 50 of these heartworms living in your dog's heart, in which case eventually they'll start to migrate to the lungs, and that's when we really start getting into complications. Easy to diagnose. Yeah, so definitely if you suspect that you're, so getting back to the signs and symptoms, first we're starting to look for dogs at the early signs, exercise intolerance, and then sometimes they're just getting a little bit older, maybe, but it could also be because of heartworms. then it can escalate more into coughing episodes, primarily at night or early in the morning or after exercise. And some of these dogs over time, as it becomes more progressive, these dogs, they will start to become just more lethargic. They just don't have their energy that they used to have anymore. We mentioned the exercise intolerance, but a lot of these dogs will just become sort of seem older in time. And then we get to the point where in extreme situations where these dogs are having a real hard time breathing. In some cases, we might get some leakage of fluids into the abdomen, so they come in and their belly starts to swell. And those are obviously really extreme and severe cases of heartworms. But generally the two things we're going to see: exercise intolerance, and at some point coughing.
What are some middle to late stage symptoms of heartworm?
Yeah, just as I mentioned, dogs that are having a really hard time trying to breathe, getting up, just not wanting to getting engaged as they used to with family members or other dogs, and in situations where we do start getting liver involvement that starts leaking, so they start looking bloated in the abdomen because they start leaking fluid into the abdomen.
What can be done to stabilize my dog's heartworm disease?
It depends on the stage of the disease. Obviously, if we catch it when your dog's quite young, then obviously we can treat it with great success and with minimal issues or associated with the treatment itself. If it becomes more progressive, then of course we have to get involved with obviously treating the disease, but also getting some medications for the heart, for the fluid buildup and things of that nature to try to stabilize the dogs.
How soon should I bring in my dog to see a veterinarian for heartworm prevention?
Well, we like to get started with puppies the first time we see them. And again, we start seeing puppies at 6, 7, 8 weeks of age with their first vaccine. We like to get those puppies started with heartworm prevention right away. Because if a dog gets bitten by a mosquito on the day they're born, they can become infected, even on the day they're born. So the sooner that we can get them on prevention, the younger we can get them on prevention, the better for your dog to protect them. Because this is year-round medication. This is medication we're actually needing to prevent mosquitoes year-round. And that is important to recognize. Yes, we don't see near as many mosquitoes in January and February as we do in June, July, and August or September, but they can be a year-round problem in this area. They start to emerge when temperatures hit about 50 degrees or so. So we just be aware that mosquitoes can be year-round in this area or are year-round in this area, and we definitely need to keep your dogs on prevention all year, nonstop.
How will a veterinarian diagnose if my dog has heartworms?
Very simple. We do a blood test, and we do lots and lots and lots of blood tests for heartworms. Essentially, we just take about 2 or 3 drops of blood. We have a test. It takes 10 minutes to run the test. We have 2 different types of tests for the heartworms. We have one test that's just heartworms only, and for those dogs that do spend a lot of time outside, we strongly recommend doing the test not only for heartworms, but also test for Lyme disease, another tick-related disease called anaplasmosis, and another tick-related disease called Ehrlichia. So we do have those 2 different tests. And yes, the one that does more costs a little bit more, but it can be well worth it, especially if your dog spends a lot of time outside.
Why is early detection and diagnosis of heartworms so important?
Yeah, so think of this being like somebody with cancer. The earlier you detect it, the earlier you catch it, the greater chances of success with an easier form of therapy, treatment, and kind of resolution of the disease. Heartworms, yes. We'd much prefer to see if a dog's going to get the disease. We'd much rather see it. We tested them last year, they didn't have it. We tested them a year later, and now they've got it. They haven't had the heartworms for very long, right? But if we see dogs coming in that have never been on prevention, these dogs are 6, 7, 8 years of age, gosh knows how long they've had it. And it's a really, by this time, we're getting a lot of changes going on in the body involving the heart, the lungs, the liver, and the more damage to the heart, the lungs, the liver, some of that's irreversible. And again, we can still treat for the disease, but again, some of the damage is done. So the earlier we can catch the dogs with heartworms and get them on treatment, the sooner that we can help prevent this cascade of problems that can occur from the disease. So with that, thank you guys for joining us today. Hopefully that'll give you a little bit of an overview, and hopefully if your dog's not on prevention, and definitely if you're not giving it every month out of the year, if you don't take anything else away from this conversation, please make sure you get your dog on heartworm prevention, and please make sure they're on prevention all year round, 12 months out of the year, nonstop. With that, thank you for joining us. Go to our website, CarolinaValuePetCare.com, look at our schedule, and we hope to see you soon. Thanks.